Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Good morning once again. It is 8:35, time for our Ask the Expert show here on WAJR called Health Talk, which is brought to you by Mon General Hospital. I'm Jim Stallings along with co-host Kay Murray. Good morning, Kay.
Good morning, Jim, and we talk about health.
Yes, that's what we do.
Health
and your
Talk.
Phone calls are always welcome at 304-296-0041. Today's topic is glaucoma, and our guest is ophthalmology physician Dr. Joe Figali. Good morning and welcome to the program.
Good morning. Thank you. Good to be here.
Tell us what an ophthalmologist is. I mean, it's different than an optometrist or some of the other eye specialists that we know about.
Yes, we're both called eye doctors. The difference is in the training. The difference between ophthalmologists is that they do go to medical school. They have to get a medical degree before they go into training for eye disease. Optometrists go to optometry school, which is a 4-year college degree.
And they're the ones that get you your glasses and check your vision to see what kind of glasses you
Absolutely.
need. But they also can check for glaucoma, right?
They can check for glaucoma. They can give you an eye examination to check for diseases, and glaucoma is one of them.
Okay, let's talk about what is glaucoma.
Well, glaucoma is a disease of the optic nerve that causes the nerve to gradually degenerate and resulting in irreversible and permanent loss of vision. Now, let me explain what the optic nerve is. Our eyes are the sense organs for sight. We see with our eyes. But the eye captures the image, but cannot interpret the image. It has to send it to the brain for analysis. And what connects the eye to the brain is the optic nerve. And that's a collection of very fine fibers linking the eyeball to the brain behind it. And these are tiny structures that pack roughly 1 million fine fibers on each side for each eye. And these fibers are very delicate. They're susceptible to damage from different reasons, and when they die, there's no transmission between the eye and the brain, therefore we cannot see. So we gradually lose our vision.
All right, so if you have a camera on your computer and it's connected via USB, the optic nerve is a USB cord because the camera can't really figure out what the image is, so it goes to the hard drive on the computer for it to figure it out.
Exactly.
Hey, how about that?
Yeah,
I'm
you got
impressed.
it.
So, but the optic nerve, it starts to deteriorate, or it just doesn't transmit information like it did before?
The individual fibers forming the optic nerve die, literally. This is what happens one after the other. And once we lose so many of them, then we don't have the capability of making the synthesis to analyze the vision anymore. So we start having deficits, different parts of, we call them blind spots in the peripheral vision first, and then they come to involve the whole field of vision.
So we need to know what kills the optic nerves.
We'd like to know. We certainly would like to, but we can't say we do yet because it looks like the causes of glaucoma are multifactorial. It's not one thing. We know we have some idea about what might be involved, but we're not sure which one plays the bigger role and which one exactly to treat if we're not being successful in treating the way we do.
Does aging have anything to do with this?
Certainly, aging is considered a risk factor. We all age, and it's an unavoidable risk factor. As we get older, our chances of developing glaucoma increase significantly.
Health issues, diabetic, something like that, as far as our body and the health of our body?
Generally speaking, not. Diabetes is not at this point recognized to be an increasing risk factor. We do not know at all if it plays any role, good or bad, but we do not consider it a risk factor. One disease is an eye disease that is a known risk factor for glaucoma is nearsightedness, myopia. People who are nearsighted are at increased risk of developing glaucoma.
Is there anything that we can do to prevent that? I think a lot of time with our eyes, we take them for granted. They're there. We don't take care of them like maybe we do when our hands get dry. We just seem to take them for granted.
Speaking
until
of that,
something happens.
certainly, glaucoma is known to be a silent disease. And many diseases would give you like pain or redness or something. Your vision is blurred right away, so that alerts you, and then you can try to do something about it. With glaucoma, it's typically painless. You don't have any pain. Most of the time, there's no redness in the eye or any other signs to alert you. The loss of vision, when it happens, unfortunately, or maybe fortunately, it starts in the outskirts of the field of vision, so they're difficult to notice initially. And it's not until the disease progresses to significant stages that one becomes conscious of the deficit in the vision. And then this is when people panic and you try to do something, it may be a little late at this time. So basically, the best way is to be proactive and look for it before it happens.
How do we look for it?
Get examined, get an eye examination. And it's important at this point to point out that an eye examination is not just checking for glasses or contact lenses or checking if the vision is good or bad. It is very important to detect glaucoma. In order to detect glaucoma, to have a dilated pupil examination, because this is where the doctor has the ability to look inside the eye through the pupil and evaluate the optic nerve to see if it looks sick or healthy. If the optic nerve is suspicious or sick-looking, then more testing can be done to confirm the disease.
I would imagine a lot of us have had this test. I think of the field vision test. Is that part of checking for glaucoma?
The field of vision test is certainly a big part of checking for glaucoma, but usually the need for it is triggered by an abnormal appearance of the optic nerve. If we look and see that the nerve doesn't look quite right, first thing we do is get a visual field test to check for loss of vision.
How can you see back there behind the eyeball to look at the optic nerve?
Well, the eye has it has a refractive medium consisting of a lens, a magnifying lens, and the cornea on the front. And these make it difficult for one to see if you just look with your eye and with a regular magnifier. We have special magnifying machines and we use lenses in order to overcome the power of the eye to deflect the light. And by using those lenses, you can see the back of the eye directly.
And what are you looking for, or what do you see when you look for glaucoma? Can you look at the fibers, the optic nerves that closely?
You cannot look at the fibers, but you can look at the whole structure. And the actual size of the cross-section of the optic nerve is about 2 millimeters. It's a tiny structure. But remember, you're looking under magnification. So when you look through the pupil, you see a circle, which is the cross-section of a cable. That circle, you look at its color. You see if there's any cavitation in that nerve, and cavitation, an increase in the size of the cavity in the nerve, is what really points in the direction of glaucoma. The nerves in that optic cable are not tightly packed. There's a little emptiness in the center. You look at that emptiness, and if the size of this emptiness is bigger than normal, then you suspect that these nerve fibers must be dying slowly. And we call that the cup in the optic nerve, or the cup-to-disc ratio is what we measure. If it is considered bigger than expected, then further investigation is warranted.
All right, if we're still trying to determine what causes glaucoma, diabetics are not necessarily susceptible to it. Does everybody need to get glaucoma testing because you just never know who's going to get it?
Yes. It is highly recommended that after age 40, we all get a baseline eye examination, of course, if not done sooner. If we have healthy eyes all during our adult lives, maybe at 40, it's a good time to start. Just getting a basic examination, not only to rule glaucoma, but to rule out other diseases.
Jim had asked about the optic nerve and why it dies, and you said you have some ideas. Maybe we can cover that when we come back from the break.
Yes, we invite your phone calls at 304-296-0041. This is Health Talk on WAJR.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
Ophthalmology physician Dr. Joe Figali is our guest today. 304-296-0041.
Yeah, you had asked the question about why the optic nerve would die. And I know that the doctor said you don't know, but you have some ideas. in layman's terms, can you tell me what you're thinking or what could be
Yes.
causing this?
Fortunately, we have an idea that works for most people. And, and we've heard that eye pressure, when elevated, can cause the nerve to die, which is very true. However, we do not want people to believe that if your eye pressure is not high, you do not have glaucoma. Glaucoma can exist with or without eye pressure elevation. So that's why it's important not to go by what the pressure reading is, but what the nerve appearance is.
Of course, I'm going to ask, why would the pressure go high? Why the high pressure?
It may be a matter of wear and tear as the body ages, the ability of the natural drain of the eye to clear the debris and the fluid from the eye gets impaired, and therefore there's a backup in the drain and then pressure build up inside the eye. That's one possibility. There are probably other causes that we do not understand. There are genetic factors which may cause that.
Is there anything that I can do to avoid getting glaucoma?
Generally speaking, no. People ask all the time, is it something I'm doing? Is there anything I can eat, modify my diet or exercise or anything like that to prevent glaucoma from progressing or for me not to get it? The answer, unfortunately, is no. It's not diet related, it's not exercise related. Exercise is not going to hurt you. It does lower eye pressure, but unfortunately, it lowers the pressure for like 20 minutes. And then it's back to its baseline after intensive exercise.
But is there a relationship between long-term high glucose levels? I mean, not treating your diabetes for a long time, can that also harm your eyes?
Absolutely. Diabetes, if uncontrolled, can be a devastating disease. And again, I say if uncontrolled. People who are diabetic and who control their blood sugar properly can have many, many years of good vision without serious problems. Now, with passing time, things may change. Now, whether you do the right thing or not, there's some chance of the eyes getting involved, but not maybe in a devastating fashion. In the case of an uncontrolled diabetic who does not put any effort into watching what they eat or taking their medications properly, the eye can be severely affected. And in that situation, there's a kind of glaucoma called neovascular glaucoma that is the result of the growth of blood vessels inside the drain of the eye. That this kind of glaucoma is difficult to treat and generally does not respond to medications. It only sometimes responds to surgery. And that is the kind that we do our best to avoid by keeping adequate diabetes control before it's too late.
Yeah, I see. That's where the pressure check comes in. They numb your eyes with some drops, and then they determine the pressure of the fluid on the inside of the eye, because if that drainage is blocked in some way, the pressure will be too high. Do I have that right?
Correctly, yes. That is true. And checking the pressure is a very simple test in the office. The eye is numbed with an eye drop. The numbing lasts for about 5 or 10 minutes. It does not affect the vision to any significant extent. And when the pressure is measured, it does not cause any pain. It's just a brief test lasting just a couple of seconds. And that gives you an idea what your starting point is. And pressures do change, like your blood pressure changes throughout the day and night. Eye pressure changes all the time, but it changes within a finite range. Like, 2 or 3 points up or down, that's considered acceptable. But if we see swings of 8 or 10 point change in pressure, that is not normal.
All right, let's get back to that optic nerve degeneration. If you have determined by looking at the back of the eye that there is some degeneration of the optic nerve, is there a way to treat it or regenerate it, or with medicine do anything?
There is a way to treat it and control glaucoma for many years, and it so happens that lowering the eye pressure will make a big difference in controlling the disease. In most instances, lowering the eye pressure to a safe level will stop the disease, or at the very least, slow down the progression to a rate that does not really impair vision in the long term. Now, I said most cases respond to lowering of the eye pressure, but not 100%. I would say the vast majority, maybe 85, 90%, will do well just by pressure reduction. So if it's not the pressure that's causing the problem, it's something else, possibly like a diminished blood flow to the eye. then our ability to treat the condition is much more limited because we do not have a good way to improve blood flow to the eye if it is impaired.
You talked about treatment. What type of treatment are we talking about?
There are a couple of kinds that we consider initially. The most commonly used one is eye drops. We have different kinds of eye drops that lower the pressure in different ways, and they work pretty well for a good length of time, sometimes years, 7, 8, 9 years. And one may have to take more than one kind of eye drops, sometimes 2, sometimes 3. So it's an expensive kind of treatment, and it requires cooperation on the part of the patient. If people forget all the time or neglect or ignore their medications, we're not going to accomplish much. The disease will progress and people will be losing vision. The other kind of treatment consists of laser to the eye, and that laser is not the kind of laser that people have to improve their vision. It's a kind of laser that's geared only to lowering the pressure. And it does work maybe 2 out of 3 times. It does help like medications do, and you can get a pressure reduction lasting years from that. And the treatment sometimes can be repeated.
304-296-0041. If you have a question or a comment, we'll take a break and be right back.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
The topic is glaucoma with ophthalmology physician Dr. Joe Figali. And you mentioned that we could take some drops that are effective in treating pressure and glaucoma. Is there anything else we can do at home?
No. A word of caution for people who are on asthma medications consisting of steroids, or people who take steroids for other reasons like arthritis. These medications can increase eye pressure and can cause vision changes. So when they are on such medications, they need to be under medical supervision and include more frequent eye examinations. Pressures would rise if somebody takes steroids for longer than a few weeks. And that doesn't apply to everybody, but a significant percentage of people would get that complication.
And you probably ask patients for their medications when you treat them, because that's the kind of thing you need to share with all your doctors, all the medications you're taking.
We always do that. We have a complete listing of all the medications that patients take, and we try to figure out if any of them could be interfering with pressure regulation in the eye.
And at the age of 40, you say we should start getting regular glaucoma testings.
Right. And now people who have history of glaucoma in the family should be particularly aware of their increased risk. So again, the risk factors that increase your chances of getting glaucoma are age, we mentioned that, family history, nearsightedness. Black people are at higher risk for glaucoma than whites. And people who have a thin cornea, that's not something you would know, but that's something that's measured in the doctor's office if we are suspecting glaucoma. So basically, family history is a big thing. If you know anybody in your family or relatives has glaucoma, then you need to be examined. Some of the glaucomas are very strongly transmitted familially. So
I'm guessing I got a thick cornea. Everything about me is thick, so it's probably the case there.
Can you believe I'm being quiet on that one?
You know you're not. You just said something.
I'm just going to be real quiet.
All right. The topic, glaucoma, today. Obviously, there's probably information online. We want to read up more about it. But it's interesting at the nearsightedness. I mean that you can see up close with nearsightedness, blurry vision when things go far away.
Correct.
So no matter what age you are, if that's the case, you should probably make an appointment with your eye doctor.
And the higher the degree of nearsightedness, the bigger the risk. Like many people have -1, -2, -3. That's not really a big risk. But those who have -8 and -10, they're more vulnerable, yes.
All right. Very good information. Thank you, Dr. Figali. We appreciate it. We hope you come back. You say you were here about 19 years ago?
Yes, I was.
We were here then.
Yep.
Wow, that was
Yep.
many, many shows
Been
ago.
together about 25 years.
You've been listening to Health Talk, brought to you by Mon General Hospital. Coming up on Morgantown AM.